So I'm Georgie, I'm the 5K Your Way operational manager. And I've been doing this role for a year now. So it's been an interesting year, not quite exactly what we planned with COVID and everything going on, but that is why we've been able to do some awesome workshops like this. So it's really, really nice to see you all. Thanks so much for taking the time to join. And first of all, before we go into a bit more of an introduction, I'll just quickly do a few more little housekeeping things. So hopefully I think I can see everyone's on mute, so all good. If you do want to ask any questions or put any comments, please just pop them in the chat box. So hopefully you can see at the bottom of your screen, it says chat there. I'll just say hello in it now. And Tom and myself and Rebecca will be watching in that as well. So just say hi in there, that'd be great. And just so you know, this will be recorded, but don't worry, you won't see any of you or hear any of you or see any of your comments or anything. You'll only see the people that are talking. So then we'll be able to share it with anybody that couldn't make it. And I think that's all the little background things I need to say. So quickly, just about 5K Your Way. We are an initiative provided by Move Charity, and we're a support group with a difference. So aiming to support people living with and beyond cancer, their friends, family, and healthcare professionals to go to Parkrun on the last Saturday of every month. So unfortunately, we haven't had our groups recently for a whole year, in fact, which we're so looking forward to them starting again in the summer. But it has enabled us to focus more on the education and the signposting side of things. So enabling us to do stuff like this, which is fantastic. And so far, we've had 3 workshops on cancer-related fatigue and goal setting and exercising after abdominal surgery with a stoma. So if you would like to catch up on any of those, they are on our 5K Your Way website and our YouTube channel. And so afterwards, I'll send an email with some links that might be helpful for people that if you're interested in anything else that we do. So today we've got a fantastic workshop based on exercising during chemotherapy with Tom and Rebecca. So we're honoured and really, really chuffed to have Tom and Rebecca leading this workshop. And I know that Lucy and Gemma and loads of people I've worked with, ambassadors, have asked about exercising during chemotherapy. So this will be fantastic, really big learning curve for all of us. And so without further ado, I'm pretty sure everyone's in and everyone can hear us. I will introduce to them. So Rebecca is over here, Tom is up here on my screen, but they'll share their screen and they'll pin themselves, sorry. So Rebecca is a consultant in sport and exercise medicine, an international athlete, and one of our Endcliffe Sheffield 5K Your Way ambassadors. So awesome to have Rebecca with us. And Tom Cowan is an exercise physiologist and cancer rehab specialist as well. And he's been working with Move Charity on our Move Online program too. So amazing to have you both. Thank you so much for taking time to join us. Thanks everyone for listening, and over to you guys.
Thanks very much, Georgie. It's really exciting to be here. I'm just going to introduce what we're going to talk about a bit, and then a little bit about what I do, and let Tom introduce himself too. So I guess thank you all for joining. I think one thing at the outset is, like, for anybody who's experienced cancer or works with people experiencing cancer, you have a lot of expertise on this. And I think it's an area we're all still learning into. But really, we're going to just talk about what it means to be moving, to be doing exercise during chemotherapy, whether it's something that's new for you or something that you've previously done and actually a cancer diagnosis has changed that. So as Georgie's introduced us both, I'm a consultant in sports and exercise medicine. It's a medical job. Tom's an exercise physiologist, which is, again, really important as a specialty in terms of rehab and also monitoring performance. What we're going to talk about, I think Tom's on the next slide, is just the kind of topics around chemotherapy. So I'm going to talk a little bit about the kind of medical side, not going into huge depth, but what is chemotherapy as a treatment? And I think that's kind of useful because, as Georgie says, there's some brilliant pieces already, and we may have future ones, hopefully, and different types of exercising after different types of surgery or treatment. But this is specifically around chemotherapy and what that might mean. We're not going to go into lots of details of all the different types. So it's quite a general discussion because we kind of found there was enough to say, hopefully, around that too. And Tom's going to talk about the actual benefits, which is the exciting bit, the things that we know are good about exercising when you're having treatment, and how to do that, because it can sound quite simple, it can sound quite challenging. So we're going to look at that. I'm going to talk a little bit about health and lifestyle. So that means really what the other things that can support your exercise might be. Is it actually something that's possible right then? Do you need to think about nutrition and other factors in your life? And then we're going to talk a little bit about what might come next in terms of managing your exercise into the time after your treatment, or if you're on ongoing treatment. So that is what we're hoping to cover. I think it will be quite busy. Please ask questions. We'll try and filter a few of them in, but we'll try and answer them afterwards. If we don't get to your question, we'll try and pick those up on an email for you. So just in brief, what do? I'm a consultant in sport and exercise medicine. And that sometimes is a title people ask what that means. So I'm a medical doctor and I've done hospital medicine, then specialized in really this thing called exercise medicine. And it's a job where I work with Olympic athletes and I work with people recovering or managing long-term illnesses. Sometimes both happen at once. So we look really at the physiology, we look at the medical side, how people are managing the treatment, the impact of illness on their whole body, and what that means. So I currently work in Olympic sport, also work at Centre for Health and Human Performance in London, primarily around the exercise medicine side, and currently in the NHS, looking at trying to build exercise medicine into the NHS. And also as COVID is something that we're learning about, working in COVID rehab. I'm very excited to be an ambassador for 5K Away and missing that hugely at Sheffield, hoping that comes back really soon. And I do run quite a lot myself. The other thing that I've done in the last couple of years is worked on a project called Moving Medicine that we'll mention at the end. And this was all about trying to get the conversation started between people and the health professionals and how to get people into that space of thinking about movement. And that was specifically around cancer. So that in a nutshell is kind of what I do. I guess over to you, Tom.
Sure. Thank you, Rebecca. Thank you for the introduction. And firstly, Georgie, Gemma, thank you for having me present today. And it's a pleasure to be speaking with you all. If you have any questions, as Rebecca said, please feel free to drop them in the comments box, and hopefully we can get through them at the end of today's presentation. But if not, I'm more than happy to answer them via email following this presentation. Just a brief introduction to myself. As Rebecca said, I'm an exercise physiologist, which essentially means sort of exercise testing, but mostly prescribing exercise programs for cancer patients, which is one of my specialties, being a cancer rehab instructor. A little bit about me: I'm a keen runner, as you can see in the middle. I've been lucky enough to sort of join up with Move Charity over the last year, particularly in lockdown, helping on the online programs, helping young people with cancer, and helping them through treatments. Some of the other things that I've just included there, you can see an article that I've helped to get into Athletics Weekly, which was on the benefits of exercise and cancer, and then also speaking on the BBC about exercise and cancer. And I just wanted to include those because I think it's becoming more and more of interest. Exercise is becoming seen as so important now for patients going through all different types of cancer interventions. And it's not just, in the medical world, but it's also now becoming very, very publicly seen as well, which is great. So just following on really from that, this isn't the first time that Rebecca and I have worked together. As she mentioned, we did the Moving Medicine project together, which was a project that was put together by the Faculty for Sport and Exercise Medicine UK and Public Health England to provide a resource, an online free resource for both practitioners, oncologists, and also patients to sort of be able to refer to get some general advice around how to get active during cancer treatment. So that's something that we'll talk a little bit later in the presentation about in a bit more detail. Okay, and over to Rebecca. Rebecca's just going to guide you through a few slides on what chemotherapy is.
Oh, Rebecca, you're on mute.
Rebecca.
That would really help.
There we go.
Or maybe it wouldn't help, I don't know. But so I'm going to say one thing I will keep on a kind of mute is talking too much into the medical detail, because your treatment's going to be really specific to you. And we don't want to go into too much detail. We're just talking about some generic things here. So in very basic terms, chemotherapy is a treatment that kills cancer cells. So it is stopping the growth of those cells at a certain point in their cycle and hoping to encourage those cells to die that we don't want. We know that doing that, and we'll come on to talk a little bit about the side effects of chemotherapy and exercise a bit more. I know Tom's going to cover that, but it will have an effect on the whole body. So it's a systemic treatment. It travels widely through the body, and that's usually through the blood. And so that means that it can affect the whole body, and other cells that are kind of quite vulnerable, like your hair cells, that's where it can have that more systemic effect. But its bottom line is it wants to stop those rapidly dividing cancer cells. They often divide fast, and they've got those mutations that it's going to be stopping that process from driving. So it wants to damage their DNA. Yes, it has a whole body effect, and we need to learn more. We do seem to know that exercise appears to be helpful at that time, but it's very much something that we're learning exactly how that happens. So different types of cancer does need different treatment. It's important to understand what type of treatment is being prescribed for you, and that's important to understand from your oncologist and CNS. But I think it's never too early to discuss with health professionals what your exercise program can be like. That's somewhere that myself and Tom often work, and we've trained in that. We can advise with those oncologists. I guess it was kind of something I wanted just to put in to say what chemotherapy isn't, but you might have it as part of your treatment too. So sometimes we're talking about targeted therapies. So people might have heard of like antibodies, monoclonal antibodies that are used, and hormone therapies, such as those that are used in prostate cancer and breast cancer. So we're not talking specifically about those treatments, but we're aware that those might be treatments that you are on as first or second line, and sometimes with a chemotherapy agent. So most of the talk today is about actual chemotherapy. Briefly again, but kind of relevant to the piece around how you exercise with chemotherapy, is how that treatment is actually given. So I think that's on the next slide. Just there, thank you. So this is again kind of an example, but a course is planned and will be planned by your oncologist, and that is dependent on someone's diagnosis and stage of treatment. Very typically, they might be looking at a 3-month period of treatment for a course of chemotherapy. It can be longer or shorter, and that can be informed by the disease and the scans that you'll have, and most importantly, those discussions with your specialist. Cycles are given typically every 3 weeks, but that can be shorter or longer. So bottom line is about 2, longer is about 6, and some people will be on a daily tablet treatment. So these are things just to think about in terms of when someone's planning exercise. We'll talk again about how that can fit in to when a regime might fit well with starting a new program, or when to do more, when to do less. So the treatment is usually given by an infusion, and that is something that is often done in a clinic. Some people might have them at home. Some people might need to come into hospital. Many people will have that going into a clinic for the day or part of a day, and having a treatment through a vein. So that's called intravenous treatment, and that will need either a cannula or a line that stays in for longer. So you've probably heard of like, or had PICC lines, central lines. So that's a way of giving that treatment. Again, just things to think about in terms of the time it takes around that in someone's week, and also what it means in terms of having access to different parts of the body in terms of if you've got a line. We'll mention that later too. What does that mean for being able to exercise? When someone has chemotherapy, it targets the cells that we want to target, but it also has an effect. So like in the olden days, I'd like to say it does still happen, but chemotherapy can make people feel quite poorly when they're having it. And now we try to have medications that go alongside the chemotherapy to reduce those side effects. So around the time of treatment, you might have treatment with steroids and usually sickness medications to help those symptoms. I think the one to mention really a little bit is steroids, because we try to minimize the use around a treatment. Some people, for reasons around their own illnesses, will be having those longer term in cancer. But we need to know that the steroids also can have their own side effects. We're going to come into more detail about the actual chemotherapy. So this is just the time I'm going to mention the steroids can alter energy levels. So you might have that kind of huge amount of energy that people have when they're on steroids at first, but it's actually sometimes not something that relates directly to exercise energy levels. Appetite can increase. That's just something to be aware of, because we'll talk a little bit about weight management. It's not something that we want to super focus on. We just want people to be healthy through their treatment. But sometimes if there's significant weight gain and also loss of muscle, that can happen with steroids. So when possible, we want to limit those doses around treatment. But I think if someone's on a steroid for a long time, it's also good to speak to a specialist and just know what those issues are, and does it affect you and your muscle and bone health, and also in terms of just your general overall wellness. We will talk more about some of the aspects of chemotherapy, which are that whilst it's doing its job, your blood counts can be lowered, so it can have an effect on those immune cells, especially in your blood, that usually fight disease. That's all an acute effect of the treatment. And we do know that the treatment can have significant side effects for some people. Those changes in their blood numbers will be significant. If that happens, it's usually the case that your specialist will be taking, helping you take control of that. And there might be a period when actually you need to not be doing exercise in the normal lifestyle, having some time out. Some people will need to spend some time in hospital if that happens. But that's the time to just understand that there's a breakaway from exercise. And then part of what we want to talk about today is how to do that, how to step away, how to get back into things. So that's really brief around chemotherapy. So if anyone's got specific questions, I think that's probably one to answer afterwards. But I think it's probably a good point to bring Tom in and just to talk about the benefits of exercise during this treatment that I probably made sound a little bit daunting, but many of you will be far more versed in it already. Tom. Thanks,
Rebecca. So I'm probably speaking to the converted here, being speaking here for Move Charity. Obviously, in the title, exercise and being active is obviously a key part of the charity's ethos. So what we're going to follow on now is some of the benefits that we can expect from exercising during just cancer treatments in general, but then also moving on to chemotherapy specifically. So firstly, I'd like to just open up with a question. And this was a survey that was conducted in 2012 to see how many patients, or the percentage of patients, had been advised by their oncologist about the importance of keeping physically active both during and after treatment. Okay, so maybe just a quick show of hands if you think that answer is above 50%. Okay, above 25%. Sorry, under 25%. Okay, and the answer is, 23%. Okay, so actually in 2012, only 23% of patients had been advised about the importance of being active either during or after treatment. The good news is that things are definitely changing. So the old sort of school of thought, if you like, was that actually being rested during treatment was the way to go. So it's being active, in other words, whereas now more and more evidence is coming out all the time about the benefits of being active during treatment. And the shift, has been huge, to the point that now these resources are being created, such as moving medicine, to try and really promote activity and patients staying active throughout treatment. Okay, so some of the benefits that we can expect, or that have been evidenced, if you like, in the research that's leading to this shift, is that following a cancer diagnosis, being more active and performing superior levels of exercise has been associated with a reduced risk of cancer mortality, cancer-specific mortality, all-cause mortality, and a reduced risk of cancer recurrence. We also know that exercise can help to reduce not only the severity, but also the occurrence of treatment side effects. And this is particularly important around chemotherapy, where some of those side effects can be really nasty. And we're going to come on to some of those side effects on the next slide. And there's also increasing evidence to show that exercise during chemotherapy can help people to complete more rounds of chemotherapy, which in itself can lead to better treatment efficacy. So in other words, having more doses of the chemotherapy can help the treatment to be more effective. And there's also some suggestions that exercise may help to improve the structure of the blood vessels, and therefore how much blood and the perfusion to the tumour itself, which could help the delivery of chemotherapy medications to obviously target the tumour, and then reduce toxicity from the chemotherapy as well, as I've put there. So really, I guess in summary, what we're trying to say is that exercise has the potential for patients to improve not only their quality, but also their quantity of life, potentially. Okay, so on this side, I've got some of the side effects that are common across all the different sort of real types of treatment that a patient may be going through. Obviously, for today, we're going to focus on chemotherapy. So as you can see there, there's a whole different host of huge range of different side effects that a patient undergoing chemotherapy may experience. This ranges from fatigue to body compositional changes, to sleep difficulties, all sorts of different things. Fatigue, the second one listed there, is probably the most common side effect that we'd expect a patient undergoing chemotherapy to experience, which is difficult in a way because that can often encourage a patient to actually become inactive during treatment. So really that's what we're trying to advise against, for reasons that I'm going to come on to in the next few slides about the further benefits of exercise during chemotherapy. But it would be quite understandable for someone to actually want to become inactive during treatment, and therefore it does require quite a lot of motivation as well as encouragement from perhaps your support network, friends and family, to try and keep you active during treatment to really gain the benefits that I'm going to come on to in the next few slides. Another thing I wanted to just point out about this slide is that, as you can see, for surgery, for chemo, for radiotherapy, for all of these different treatments, there is a lot of negative side effects that can come with it. But obviously what we know about exercise is that if it's done correctly, and really that is the key, that it has to be done correctly, there really aren't any negative side effects to come from exercise. Okay, so these are some of the treatment side effects that we could expect someone to maybe experience. This isn't just limited to chemotherapy. This is sort of talking generally from all the different interventions. I'm not going to touch on all of these today, but I'm going to come on to a few of them. But what we can see is that there's side effects both physiologically and both psychologically for the patient. Okay, so moving on, going on to body compositional changes that Rebecca sort of touched on briefly earlier. Obviously, body composition, what we're talking about here is how the tissues that make up the body. So we're thinking about muscle, we're thinking about fat, we're thinking about bone and water, but particularly we're thinking about muscle. And during chemotherapy, as I said, one of the most common side effects to experience would be cancer-related fatigue, which may encourage the patient to become inactive. Unfortunately, being inactive is likely to lead to a reduction in muscle mass, which we refer to as sarcopenia, okay, which I've listed here. So sarcopenia, unfortunately, has these negative, or is linked to these negative consequences that we obviously want to try and reduce as much as possible and reduce the risk of those occurring. So one of the things that I'm very, very keen to promote with all the patients I work with who are undergoing chemotherapy is strength training. And this is often a fairly probably overlooked and underappreciated part of an exercise program is the strength training. So by strength training, we mean any type of exercise that's really involving some sort of resistance. So that could be body weight exercises, maybe things like press ups or dips or squats, lunges, any of those things that you've probably seen maybe on exercise videos or other people performing in the gym, etc. You can use weight as well. So that could be dumbbells, or it might be using simple pieces of equipment that you can pick up very cheaply, such as resistance bands that will, again, provide that level of resistance and just give a little bit more variety to the exercises that you're performing. So strength training would be a really, really key thing to include in the program for the objective that we're trying to achieve of maintaining someone's body composition, and particularly really looking to maintain and maybe even develop their muscle mass if possible during treatment, at least trying not to let that muscle mass reduce. So by trying to develop someone's muscle mass, what we're also doing is hopefully improving their metabolic rate and helping them to maintain a healthy weight during treatments as well. And again, that's sort of counteracting being inactive, if you're inactive, we'd be thinking that the body composition could change negatively, because you might also be gaining weight, but also gaining fat as well. So trying to maintain a healthy weight, and also by performing strength training, trying to maintain muscle strength and function, which should help you to be able to perform what we call ADL, so activities of daily living. That might be just things like carrying shopping bags, or if you've got a baby, carrying a baby around, or even just doing simple things such as going up and down stairs, which if we're doing strength training and providing that level of muscular endurance training, if you like, then it can help you to perform those exercises without tapping too much into your energy reserves, which hopefully then gives you that level of energy to be able to expend in other things during your day, and stop you feeling so fatigued. Okay, and then the last thing really just to touch on is that strength training can also improve bone mineral density, which I've abbreviated there to BMD. Reduction in bone mineral density is not really so much of an issue with chemotherapy, but perhaps if you've undergone hormone therapy, bone mineral density can be reduced. And what that means is that the bone itself is a little bit more liable to fracture and to break. So we need to be very, very careful if you've undergone hormone therapy as to what type of exercise we do. But what I'm saying is that strength training in the right way can actually help to improve that bone mineral density. Okay, Rebecca's already touched upon immune function, and this is another objective from an exercise program during chemotherapy, is that we're trying to optimize immune function and really try and maintain it, because as Rebecca said, unfortunately with chemotherapy, its aim is to actually kill fast dividing cells within the body. So that includes tumor cells, but it also includes immune cells, so our white blood cells. So what we often see is that unfortunately with multiple rounds of chemotherapy, multiple cycles of chemotherapy, then there is a fall in the number of white blood cells. So that then has a knock-on effect on immune function. But what we do know is that exercise can help to improve and encourage immune function sort of sustained during those multiple rounds of treatments. And it does that by hopefully, if exercise again is done in the right way, is looking to increase the number of white blood cells. And as I've just sort of broken down there, that's the lymphocytes and the granulocytes that we're trying to increase. What's really important is probably the last point on this slide, and that's that the dose needs to be correct. So by the dose of exercise, I mean both the volume and the intensity of exercise that you do. Okay, so we'll come on to what that means in a little bit when we look into how to implement exercise during chemotherapy. But one of the key take-home messages is to make sure that you're not doing too much. And sometimes we'll refer to this as overtraining, where actually someone does too much exercise and goes too far in that direction, because that can actually compromise the immune system and actually weaken the immune system, which is particularly damaging in chemotherapy patients who have already maybe got a compromised immune system at that point. So we'll come on to exactly what that means a little bit later in the presentation. And then we've just really got cardiorespiratory health and fitness. So this is another objective for me when working with patients during chemotherapy, is trying to optimize their cardio respiratory health and fitness. Sometimes people just call it cardio training, if you wanted to, if you have that abbreviation that you've heard. What we're thinking of here really is how do we help the heart to sort of function and the cardiovascular system to function better. So this is really, really important for patients undergoing a type of chemotherapy that involves a drug called anthracycline. So that's a group of chemotherapy agents that can be cardiotoxic, which means that they can have negative consequences in how the heart functions and how it works. So for anyone undergoing treatment with anthracyclines, then there is really sort of a few more considerations that we need to take into account. And again, I'm going to come on to those in a little bit later on in the presentation. But another thing that we want to sort of consider is that for certain types of certain tumor types, and this includes prostate cancer, is that the lead cause of death actually isn't the cancer, but it's the cardiovascular disease that is the main cause of death. So actually by performing cardio, if you like, so this would be your sort of running or brisk walking, it could be swimming, cycling, whatever it be, those sort of continuous sort of tends to be more longer duration, continuous types of movement. They will help to develop your cardiovascular fitness. And that's really what we're trying to do, to try and reduce the risk of suffering from cardiovascular disease, which for a prostate cancer patient could be very, very important. Okay, so they're really the benefits, very briefly, the benefits of exercise during chemotherapy. What I'm going to come on to now is how to now implement what we've just discussed. Okay, so how to exercise during chemotherapy. Firstly, I'd like to just ask the question of, or answer the question for you of when to implement it. So what we've got here is what we call the cancer control framework. Don't worry too much about this. This is just a very sort of brief overview of the different stages during cancer treatment. So we have pre-diagnosis, we have the point of diagnosis, and then we think about treatments, and we think about before treatment, so the pre-treatment period, during treatment, and then the post-treatment period. So the question really is, at which point should we be advising, out of all these different points, when should we be advising people to get active if they're not already? And really the answer is that we want people to be active at all of these different stages. Okay, so the benefits don't just pertain to the during treatment period, as I've sort of mainly focused on up until this point. Actually, the benefits are to be had during, as well as before, and as well as after treatment. Okay, so what we can see here, this is before treatment. So it's likely that a patient may already be experiencing fatigue following their diagnosis, but before treatment. And as I already mentioned, one of the ways to sort of combat fatigue, and actually the number one, the way to combat fatigue is exercise. So it would make sense that actually following diagnosis, we should be encouraging patients to be active before their treatment begins. And this goes for chemotherapy, but it also goes for surgery, particularly sort of very important pre-surgery, because it can help to reduce sort of post-surgery complications. For example, for patients maybe going through, say, a prostate cancer patient is going to have a prostatectomy and have their prostate removed, doing pelvic floor exercises can actually help them to reduce their risk of incontinence following surgery. So helping them to maintain function in that area. But very important as well before chemotherapy is to build up that level of fitness before treatment. This next bit sort of looks and implies about the safety of exercising during treatments, and is suggesting that exercise, or evidencing, if you like, that exercise or staying active and exercising during chemotherapy is safe and should be encouraged for both psychological and physiological reasons. And then there's exercise after chemotherapy. So we know that a lot of the side effects, such as fatigue, can actually persist well after treatment's finished, and sometimes they'll come on following treatment. So again, really, really important to stay active to help to combat those side effects well after treatment's finished. And hopefully, you've got into good habits during treatment, and it will only become easier to keep active and to perform exercise in that post-treatment period if you could have managed it during treatment when fatigue was likely to probably be much higher. Okay, but the key is that we do still need to consider adapting the exercise program accordingly. And again, I'm going to come on in the next few slides as to how we'll do that. But we do need to consider and take those chemotherapy considerations into account. Okay, so if that answers the when, then now we're going to answer the how and the what, if you like, or the which exercises to include. So the guidelines really from the World Health Organization is that patients should be performing at least 150 minutes of moderate intensity aerobic or cardiovascular, they mean the same thing, exercise per week. So again, this is your running, brisk walking, cycling, rowing, swimming, anything like that, those repetitive movements, those repetitive actions And ideally that'd be spread over several days during the week. So the guidelines tend to revolve around 5 days a week, 30 minutes a day, that sort of volume. It's also then advised to perform 2 to 3 strength training sessions a week, and those strength sessions should involve exercises that really incorporate all the major muscle groups in the body. Okay, so we're not just working on legs and developing leg strength. We also want to think about maybe upper body strength and core strength as well. And then also we want a really nice balanced program, and we also want to be thinking about flexibility exercises, so you're stretching, and that can be dynamic, it can be static, it can be a mixture of the two. But the key is to really try and encompass and incorporate all of these 3 different areas within your program. What I would say is that these guidelines are exactly the same for the general population as they are for cancer patients. So in other words, there's no specific dose at the moment for how much exercise you should do if you're going through chemotherapy. It doesn't differ from what's being given to the general population. So this is obviously quite simplistic, and it's not quite that straightforward in actual terms. So this statement here is taken from the American College for Sports Medicine from their roundtable study in 2019. And really one of the messages from that report is that exercise needs to be individualized. So we completely need to go away from this sort of generalized approach here and really come into this sort of tailored approach for an exercise program. And this is really where it gets a little bit tricky, gets a little bit more complicated. And I guess really this is where I can provide value to the clients and the patients that I work with, because we need to consider lots of different things for the patient. And exercise for one is going to look very, very different to exercise for another. Okay, so we need to base things around their current levels of health and fitness. We need to think about the treatment that they're undergoing. So as Rebecca said, the chemotherapy that one patient's going through could be very different to the chemotherapy that another patient goes through in terms of the different drugs that there are. As I said, anthracyclines, we might have a different consideration for those than a different type of treatment. It could be the cycle length. So if a patient's on a 2-week cycle as opposed to a 3-week cycle, the exercise prescription could be very different. And also the side effects that a patient's going through means that we need to consider different things. And I'll come on to that in a few slides' time. But the key really is to think about what you're doing currently. So the level of exercise that you're currently performing and how active you are at the moment, and then looking to gradually build up from that level. Okay, so if I'm just going to go back to this slide. If, for example, you're only performing maybe, 2 times a week, 30 minutes on those days of cycling, so you're doing 60 minutes of aerobic exercise, the key then is not to think, okay, I must step up to 150 minutes a week now of moderate intensity exercise, because for you relatively that might be too much, and that might be too big a shift too quickly, and it may push you towards, I'm not going to say that that's necessarily overtraining, but it may be pushing you in that direction, stressing the body a little bit too much. So the key really is to build up gradually from what you're currently doing. And if you can work towards that 150 minutes of aerobic exercise per week, fantastic. Okay, so we need to think about the different types of cancer. In terms of the tumor type, as I said, exercises for, say, a prostate cancer patient may look very different to the exercises for a breast cancer patient, and also the different treatment that they're undergoing. Okay, so really the take-home message from that American College of Sports Medicine study was that we should avoid inactivity at all costs. So again, promoting staying active during treatment as being the key take-home message. Okay, so these are some of the exercise considerations and adaptations. I'm not going to go too in depth with these because it can become very complicated and very detailed, but these are just some of the areas that we think about of how we'd individualize a program, if you like. So one of the side effects is that a patient may experience from chemotherapy is peripheral neuropathy, which means sort of damage really to the nerve in simple terms, and can lead to a lack of sensation, particularly in the hands and the feet. So if that lack of sensation exists in the hands, it may be more difficult to grip or potentially more dangerous to involve exercise that involve gripping. So for those patients, it may be more appropriate to maybe think about doing exercise using weight machines. Obviously, when the gyms reopen in a month's time, that might be a bit more accessible to a lot of people. Dumbbells and gripping dumbbells might be a little bit more dangerous and maybe should be avoided for someone with peripheral neuropathy in the hands, just because that grip is going to be affected. Peripheral neuropathy can also affect the feet, and that may affect somebody's balance. So if that's the case, then you may want to think about having some level of support, maybe a chair nearby to hold on to as you're performing a squat, or whichever exercise it is that you're doing, just to provide, as I say, a level of support and hopefully reduce that risk of a fall or anything bad happening. Fatigue and cytopenia. Cytopenia is this reduction in white blood cells, particularly as we go through chemotherapy. And fatigue, both of these two things really, they work in a bit of a cyclical fashion during chemotherapy, in that they tend to go up and down over the course of treatment. So at times you may feel that your energy levels are good, and at times then the energy levels may be very, very low. And it's really key then to listen to your body at those times, and to sometimes take rest, and sometimes exercise, sometimes at a low intensity. Sometimes when you're feeling good, you may be able to push that intensity a little bit more, but really adapting to how you're feeling during the treatment cycle is really, really key. And bearing in mind that both of those two things may progress and may unfortunately therefore deteriorate as multiple cycles of treatment go on. So fatigue may be cumulative, and with multiple cycles of chemotherapy, you may start to feel that actually your energy levels dropped further and further. But that's hopefully where we're using exercise at the right intensity. And I stress that sort of moderate level of intensity as being key to help to combat fatigue, may help with multiple, to maintain those energy levels, if you like, over multiple rounds of chemotherapy. Metastases, again, as I sort of alluded to a little bit earlier, metastases being where the cancer may have spread to the bone. This can increase the risk of fracture. So really one of the considerations with that is thinking about types of exercise that involve any impact. So there's a form of exercise called plyometrics, which involves sort of leaping and bounding, jumping type exercises. Anything like that would probably steer away from for someone with metastatic cancer, because that impact is really not to be advised if the bones are a bit more brittle and a bit weaker, and more liable to fracture. And then there's just a few more that I've added here. So the type of chemotherapy that a patient's going through. So I'm really going to allude here to anthracyclines. So anthracyclines being those chemotherapy agents that can be cardiotoxic, therefore sort of causing issues to the heart and cardiovascularly. We may want to think about more of an extended warm-up, an extended cool down, really sort of a very moderate level of exercise intensity, is not to stress the heart too much, but to also help to reduce the risk of really sort of cardiovascular, any sort of negative cardiovascular consequences occurring. So we know that an extended cool down, for example, can help to reduce the risk of arrhythmias. But there's one particular anthracycline called Doxorubicin, and Doxorubicin, it's actually advised not to exercise on the day of treatment if you're having Doxorubicin. And for 48 hours post-treatment, we also need to really think about keeping the exercise intensity very moderate, to the point of really only taking the heart rate up to about 15 to 20 beats above resting levels at a maximum, if you're going through Doxorubicin treatment. The last two I'll just touch on briefly. Balance. There's sort of research to suggest that patients undergoing chemotherapy are slightly more prone to falls. Their risk of falls is a little bit higher than their sort of age-matched individuals. So again, just sort of following on from the peripheral neuropathy, maybe thinking about having some level of support if you're performing exercise, such as a chair, for example, to hold on to, or a wall might be sensible, but equally you may want to think about balance training to try and improve balance. And then lastly, this is often a sort of very widely discussed area, and it's lines. So if you've got a PICC line or a central line, what types of exercise can you do? Well, we'd probably be advising against swimming, and particularly sort of any type of exercise that may affect the line. So that might be like vigorous arm movements, we'd probably sort of stay fairly clear of as well. And really that's the considerations from my point of view. So I'm going to hand you back over to Rebecca now to take over and just sort of wrap up her exercise considerations as well.
Thanks, Tom. I think there's lots of things for people to think about there, and I know there's been a few questions pop up. Might try and see if we can answer a few. I think Tom's covered an awful lot there, all of which I agree with. One question that I just saw before I come on to those considerations was things about breathlessness. I think some treatments can cause changes in the lungs. That would not be a normal side effect of a chemotherapy. I think, would you agree with that, Tom, in terms of breathlessness?
Yeah.
But I think we need to look, if you're getting more breathless on exertion, we need to look into why that is. And sometimes, like, one of the reasons I would see somebody in terms of the exercise medicine rather than oncologist is it related directly to the cancer and the treatment? If it's not, then we can start to look, well, what is happening with exercise in that response? So I think if there's new breathlessness or a new cough while on a treatment, it's a question of, okay, is it the treatment or is there something else health-wise going along? I guess linking into that kind of brings me on to the heart rate and exercise. Tom's mentioned very clearly around one treatment we do need to think about, that doxorubicin, where we're really quite cautious. I think when anyone's having that week of active treatment or the days that they're on treatment, we want to do a little bit less, be a little bit gentler on the body. So if someone's used to doing high intensity, that's kind of the few days or the week that they might have an easier week. But the heart response to exercise can be quite variable. So a lot of people that are regular exercisers already will see that if they've got their Garmin or their tracker, the heart rate may change, may be higher for a given level of intensity than they used to before. And the variability is in how low is it low and how high can it go is something that might alter. I think that's where someone like Tom's role is like really, really helpful on myself. So it's not just about monitoring the strength gains, the fitness gains. We can look at that heart rate, say, well, is that something we would expect or not? But I think for the regular exercises out there, heart rate's one thing, performance and speed might be another. So we're talking the whole spectrum here. We're talking people that want to be able to walk up the steps and get an extra sort of few meters up the road, which is hugely important and important for quality of life. Do you want to just spend some time with family members when we can and be active, or do you want to keep on doing some things like park run when we can as well and pushing things a little bit further? So in those respects, it's a case of let's focus on what's happening now and your health right now and your goals there, rather than what your heart rate might have been at a different point. I'm going to move on to my points in a sec, but don't want to miss these. Swimming, to everyone, it's not something that we always say no. Just watch this space. We're going to hopefully answer those questions around lines in a little bit more detail, because I think we've realized there's more to that. So not in this talk particularly. We say generally we've got to be careful. We've got to make sure that if people have got a line, or also when people have got new changes like scars and also stomas, that there can be ways to do what you want to do, and that's really, really important. Somebody asked before about a response to exercise in terms of lowering the immune system if you do too much. Tom has mentioned about this over exercising. It's all relative. So someone who's used to doing lots of exercise might be able to tolerate a certain amount more right at this stage. Someone new to exercising, gosh, actually doing something really good like Couch to 5K, which is a really good program to get into running, that might be something they can do. That might be quite a lot. So I think it's everyone's normal level. So if you kind of take on what you have normally done as exercise, or if you're starting anew, just be prepared to pace that through, maybe at a different level, and get that advice, because that'll mean you get the benefits and we keep on those sides of the good things and we don't suppress the immune system. So actually some exercise is really good to boost the immune system. So that's much better than doing nothing. Usually you have to do quite a lot to suppress it, but usually, chemotherapy is not part of normal life in health, but it's something that we have to make sure that that's right for the individual. And I think, again, like Tom said, individualized medicine, hopefully is the way we're going all together. But even when I work in Olympic sport, these athletes have a big, big support network behind them. So I think finding yours is something key. Going back to the actual parts we're going to down on paper to talk about here. actually Tom's alluded to those changes in cardiovascular health for guys after prostate cancer. Menopause is a time when women have the advantage that we do have over guys at those reproductive ages in terms of metabolic health, in terms of heart health. Those are lost, really. We start this curve that goes down, and our cardiovascular risks come back up and our bone health risks go down. And that is something that we know that exercise can moderate outside of a cancer diagnosis. In terms of chemotherapy, as well as other therapies, that can induce the menopause or perimenopause or some symptoms of menopause. And that for some people might be long-term, that they move into menopause for those women. And for some, it might be the shorter term. So again, talking to your specialist is key. But if that is you and has happened to you, it's just being aware that will impact your energy, your metabolic health. That's basically how quickly your system can adapt to exercise and how the turnover in terms of energy in your cells, that can be linked to risks such as diabetes and also your heart health, and in the longer term, your bone health. So we know we've already talked about how chemotherapy and cancer can impact your bone health. Perhaps if we add on those hormonal changes that might happen, we have to be more cautious, but we also think that we have a reason to say, yeah, this is where exercise can be helpful. And as Tom promoted quite rightly, strength work there, I'm also very keen to learn more. We know so much from the evidence, but we know we could know more. But it seems like actually strength at the right amount for someone can offload some of those side effects. And again, menopause is one. The general impact of cancer treatment, chemotherapy on heart health is another. So it's like looking to the long term. You want to focus in at the moment on what's right for you, what will optimize your health during the treatment. But the kind of good news there is that we know that some of that being active will have a longer term effect, not just in terms of cancer, but in terms of those other elements that we mentioned around your overall health. I think that's probably all in terms of actual impacts directly on health, but I wanted to touch a little bit on nutrition. I have colleagues who are experts and specialists in nutrition. I'm not a specialist in that, but I think it's a really good member of your team. You might well have that from your own team, such as a dietitian in the hospital. There are nutritionists that special in this area as well. It's a tricky one because I would go out there and say weight is not important, but body composition is, and that kind of means how much kind of fat versus muscle. And this is not the time to focus on that necessarily, certainly in the short term, but it's the little things that we can do to help to keep that muscle. So if you've got a certain amount of muscle, that's really important in terms of your strength. So as Tom said, that's something we might notice from your activities around the house, but it might also be something that helps you do the sport you want to do. Specialists in cancer will sometimes, and it's kind of separate, but talk about like someone's functional capacity, how able they are to do activities. And that can sometimes mean whether it's the right time for treatment for you. So that might mean a chemotherapy or an operation. So actually sometimes there's a time for really optimizing prehab. So while it might seem, gosh, what difference am I going to make 2, 3, 4 weeks before a surgery or before chemotherapy or on that treatment, actually getting the body composition there can really help. So tiny things around strength. It doesn't have to be a lot of exercise. It doesn't have to be significantly changing your nutrition, but making sure that you get good protein. So that's kind of for people, it might be dairy, it might be lean meats, it might be if someone's vegetarian or vegan, focusing more on nuts and pulses. But we want to get those in to the body to replenish after exercise. In sport, we also talk about this golden window of getting that nutrition in like 20 minutes after exercise. And I would say it's important to take on some fuel before. That might be tricky in terms of digestion, but you can look at that you take on board before you exercise. I'm just going to pick that question up. Is building muscle harder? Yeah, it can be. Cancer cells turn over quickly. They're using a lot of your energy, but it's not impossible. And it sometimes can be that if your body systems get used to that and we're fueling well, you can at least maintain muscle. We need more evidence. We need to learn more to know how much you can build, but we do think it's possible. And for people that have actually lost quite a lot of weight, so sometimes that can be really hard. Like if someone has a gastrointestinal disease or upper gastric cancer, esophageal cancer, then it can be tricky because getting the nutrition right can take a while, but sometimes it can be worth getting onto that, if that means some supplements that someone needs to take, or someone's being fed, for example, via a peg, that might be important. Get that weight stabilized, work with a medical team and dietitian, and then we can get people stronger, which is great. The other side of that, and I think important to cover too, is for some people, depending on their cancer type, depending on their previous like pre-morbid, pre-illness weight level, they might be carrying a bit much body fat. And it also might be that the treatment, like a steroid treatment, does that. That is not something, I think we all know, well, like the medical community knows that being fit is a lot more important than numbers on scales or body fat per se. And we can get people fitter. And actually that means that even if someone feels like their weight is a bit higher, they will have less fat around the organs. And that's where we don't want it, especially in view of those long-term health considerations that we want to preserve. But we know that if we can help a little bit around nutrition and get people moving more in a way that they enjoy, that in itself can be enough to help to reduce body fat for those who that is something that might impact on their health going forward. So nutrition is really a whole other discussion, but I think making sure that you've got good fuel, especially around a training session, and when you've got those planned out, that's crucial. That's kind of the thing that will make your muscles adapt, getting them that fuel afterwards. And it will also help your immune system. So getting protein and carbohydrate, might be a smoothie, might be a peanut butter sandwich after your training session, can help to just make sure that those adaptations, you get hold of them and you get stronger and fitter from them. So I think the next one, and probably one of the last ones, because we've talked lots and we hopefully get a bit of time just at the end to tell you where to find some of these resources, but I want to just talk about exercise and your well-being. We've talked lots about the physical, the muscles, the heart, and what that means. And I think a big deal is how exercise makes you feel, and also can exercise help what is a huge area, which is your psychological health. Again, a whole different talk around cancer. And I think one of the things I really like about my job is that this is probably one of the only areas in cancer treatment where we can work to an individualized prescription, and actually we can make it enjoyable. And I would say, I like the challenge. If people say they don't like exercise, well, most people like moving in some way, and we can find ways. Find the thing you want to do. If everyone's doing a 5K run and you hate running, don't do running. So, and if you love running, and actually we've got considerations about bone health, if you love swimming and we're worried about lines, this is where to have the conversation, because if Tom and myself don't know the answer, we'll get together with some other, some brilliant people like Lucy, who you probably all know, and have that conversation, have it wider to find the right answer, because people do find a way. Having said that, cancer is a very, very challenging time. And I don't think we always all have to feel motivated. Elite athletes, we've got an Olympics, and I've got some athletes at the moment who are wondering if that's going to happen, if they're going to be able to get there. So even for these people for whom happily cancer is not a consideration, and actually being able to do the sport they love all of the time is there, lots of people struggle with that motivation for lots of reasons. And I think having the challenge of cancer does mean that, any given time you might feel that actually this is not the right time for you, and don't be worried about taking that bit of time out. For people who exercise regularly, I think sometimes it's like, well, exercise might be that thing that you go to and really love and enjoy. And sometimes that can be hard, because if a cancer diagnosis means you can't do the exercise you want to do, it's the same in lockdown. If there's things that you enjoy doing and we can't do in terms of exercise, 5K or weight groups doing one, that can be challenging. You won't automatically find, gosh, we may, that this is another thing that you want to do instead. But I think looking around that is helpful. So let yourself have that bit of feeling low and then get back into it. But one thing that's lovely from a couple of studies recently too, we know that having a buddy or ambassador, somebody to help you, can really help. So get your family involved. They might be worried that exercise is a little bit much for you, but actually I think it can be very helpful to have someone with you, someone to get you out the door, someone sometimes to stop you doing too much and get you back in the door. Can be helpful. And we know there's a couple of lovely studies, the RESPECT study and the RENEW study. There were an international and then one in the UK that showed that this really does have an impact. So look around for your supporters in terms of what you want to do. And when 5K Away comes back, of course, you'll know exactly where to find them. But until it does, find other ways. If you can do stuff by Zoom, if you can do your walk or run remotely and have be linked up on your phones, as long as you look where you're going, then I think that's great. as well. And I think I did say I was going to talk about what comes next, and that for me starts during your treatment. In terms of goals, I think it's really good to have these, we talk about SMART goals, which I'll probably forget half the acronym, but basically sort of having those that are achievable goals that you can have specific things you want to achieve. So is that going to be a 5K your way, for example? Is it 5K? You want to be able to run that by the end of the year. So make sure you know what it is. You can measure it. It's 5K. And you can achieve it. Can you work your way up to it? Who can you find to help you get to that? Do you need to ask medical questions to find your way there? Make them realistic too. I mean, I think, do you know, for some people a realistic goal is, and we've had patients do this, doing sort of a stage of the Tour de France after their treatment. For some people say it's going to be going for a 2K walk with a relative or someone that you haven't been able to see during lockdowns, and having that time frame on it too. I think sometimes it can be fun to say, well, actually, do you know, I'm going to get my core strength good during this period before I start my chemo. When I start my chemo, I'm just going to reset, enjoy some walking and look at the changes in the season. So I think just finding what motivates you, if you want to write it down and plan it, that can all make it much more fun. And I would also say maybe keep a little bit of a journal on your exercise. Athletes do that. You might be doing that around your cancer treatment, but it can also show a bit of a fitness journey, the ups and the downs, but you might surprise yourself by how much you've done. And I think the bottom line, I've said about motivation can go up and down, but also remember to rest. You know, that's where the magic happens in terms of training. So you can do all this training, but your body's going to absorb it. So sometimes don't feel that you've got to be doing this all the time. We want you to be doing exercise because we think it's really good, but we also know that it's just got to be fun, and also it's got to be times we don't feel too pressured to do that, and that you can be enjoying life in general too. So I think that's all that I was going to mention very briefly in well-being, but that is obviously crucial to how we want you to feel. The last slide that we've got looks at where to find support, I think, and up there at the top, surprisingly, is 5K Your Way, Move Against Cancer, this brilliant charity that Georgie's on the call, and Gemma and Lucy are also involved with, and Tom and myself too. It's a brilliant resource. Go and find out more from there for sure. There are lots of other areas too, and I think looking at, for example, Macmillan, and also looking at hopefully finding Moving Medicine, the website there, the link will give you some resources. And for the health professionals here, that can be a very useful resource in terms of how to start the conversation around exercise, because is it just movement first? Is it someone has a specific goal? How can we access that? There's now a Moving Medicine for children and young people as well. So we've pitched it kind of differently to make it a bit more appropriate for different age groups too. And I think there's hopefully plenty in there too. I do want to mention Rehab for health professionals as well, which is a rehab. I know, Tom, you've done the training for that. And I'm just looking at a question here. I'm going to plug that for Rosie. Thank you. The Brighter Outlook programme in Sussex. Thank you, Rosie. We'll try and make that available. I think that's all that I have to say at the moment. I don't know, Tom, if you want to have any further thoughts there.
No, that's all from me, Rebecca, as well. So happy to answer any questions if we've got time, Georgie.
Hi, thank you so much, Rebecca and Tom. That was amazing. Oh, can you hear me?
Yeah.
Brilliant. Yeah, like, I mean, there's loads and loads of questions in there. So I know we've been over an hour. So I've actually copied them all into an email. So it's up to you guys if you want to start trying to answer some of them now, or you want to answer them on an email, and I can send it around to everyone that signed up, because I know we're on past 5 o'clock already.
Yeah, that's fine. Either way, happy to answer questions, and equally if people have got questions, happy to take them over email or through social media. Both Rebecca and I put our contact details in there, so if you've got any questions, then do feel free to send them through.
Super, agreed. I'm happy to answer a few, and people can obviously leave if you need to, and we'll make sure those are available. I think this recording will be available hopefully somewhere.
Yeah. Well, quickly, I'll just say a quick summary, and then if people want to stay on, we can answer some of your questions. But yeah, we've recorded all of this, so it will be available on our website and on our 5K Your Way YouTube channel. And I just wanted to say quickly that we've got another workshop coming up. I know Tom and Rebecca touched on prehab before treatment or before surgery. So that is on just got all my tabs open. The 14th of April at 4 p.m. With the Rehab for Cancer team. So that'll go into a lot of detail on that, and if you're interested. And then I know Rebecca just touched on goal setting, and Tom also talked a lot on cancer-related fatigue, and we've also done workshops on those as well that are on our website and YouTube channel already. So when we post out this email afterwards, I'll send all those links if that's helpful for people. And there was quite a few questions on PICC lines and swimming and things like that. And I know Rebecca and Lucy and Tom, other people are in conversation about, and Anna Campbell from Mind Blank, Can Rehab, thanks, they're working on hopefully another workshop on that soon. So all of these things are in the pipeline, and it's all really, really exciting to see all your questions and everything. So we will put everything in an email too. So look out for that. And also, just before we go to questions, I'm going to do a feedback form. So it'd be really super helpful for us at 5K Away and for Tom and Rebecca. If you it'll be like 3 questions on what you think we could improve or what you found useful from this workshop. So really, really appreciate it if you could take the time to fill that out. So thank you very much. And thank you so much, Rebecca and Tom, that was brilliant. But if you do want to answer some of those questions, I'll leave that to you there are quite a lot if you want to scroll all the way up, but I have copied them all. So thanks everyone as well for listening.
Super. I've tried to grab a couple of questions. Thank you, Georgie. Tom, do you want to answer some?
Thanks, Georgie. I'm just wondering if I show on my screen now, I might come off this screen. Otherwise, everyone's going to see each other's questions, aren't they? So I'm just going to stop the share.
Sounds good.
Okay, and I think we're back. Okay.
Yeah, I'm just going to keep copying all these questions. So I'll leave you guys to pick out a few, and then if we don't answer them, we will get to them because I've copied them all, don't worry. So I'll leave you guys to it. So thanks so much. Carry on. Great.
I'm just going to flick through and just see, Rebecca, where you got to, because I know you've answered a few already.
Fine. This is the bit that the technological difficulties will be. So let's see.
Rebecca, you covered breathlessness, didn't you, as an eggs version?
Yeah.
Side effects.
Here we go.
Swimming, neutropenia. Yeah, as a point that I was going to mention earlier, actually, that I know I didn't, and I probably should have done, was just around sort of the neutropenia. So if someone obviously is going through chemotherapy and their immune function's compromised, then obviously just bearing in mind sort of exercising in a public place and swimming baths, then might not necessarily be the most sensible thing to do if you're at that stage with a compromised immune system. So swimming in a public bath may just increase your risk of infection slightly. Would you agree, Rebecca, with that?
Yeah, I think it's quite an individual thing. If it's an episode where, like, often if your blood count's really low, then the clinic or your oncologist will usually be in touch, and that might be a time to do a little bit less at that time. But again, if it's something that for you, your blood counts run a bit lower over a certain amount of time, there might be a conversation to say, well, actually get those relative risks. So actually, is this something I can't do all of the time right now? Or are there ways around it? And I guess the same goes for other areas of blood counts, like low iron levels and also low platelets. Can I do a contact sport, for example? That's something that your oncologist will usually be able to advise on, but sometimes it'll be a conversation that we'll have between. I'll have a conversation with an oncologist and myself for a patient too. Tom, I've seen a question that I definitely want you to answer, which is, can someone do abdominal exercises with a PEG or stoma? And I know that this is something you know about.
Yeah. Again, it would be sort of individualized, so I'm not going to give like a one size sort of fits all answer. But yes, Rebecca and I had a patient who had had a stoma and essentially helped to build up. I guess this is really, Rebecca, just going back to the case study in mind, then we started working with them before surgery. So it was a case of actually trying to build up their abdominal strength before surgery. And then they had the stoma, and I think there was trying to think now. Rebecca, you might be able to just jog my memory on the surgery that they had. But then obviously post-surgery, we're really just trying to rehabilitate and build that strength up, initially with sort of more sort of holistic exercises, so that we're working sort of the whole body and just passively engaging the abdominals, and then in time obviously building back towards isolated exercises, maybe thinking around a sort of isometric exercises as well, and potentially avoiding those to begin with, and then gradually bringing those back in time. Just that isometric, so talking things like planks, can increase that intra-abdominal pressure, and maybe not the best thing.
I think it is a question that will be in the whole talk on stomas, but I mean, Tom, obviously you did that really specifically with the patient, and that's, if someone's actually, so that particular patient was having chemotherapy, was it after that treatment? So we still wanted to get that strength going in and get that exercise going in. So that's one where it's like, it's got to be, it's like, it was a modified yes, I guess, isn't it?
Yeah, sorry, yeah, it's a modified yes, yeah.
As are the answers to, there's another question on there, so I'm just cherry picking them out, I'm not being systematic at all, but Stephen, I think, said about what percentage heart rate to work to, and the good thing on the next one said that he'd managed to be active in triathlons, and also that golden line that I would obviously promote, saying rest is training too, but obviously being active in triathlons. I think there's probably areas you'd want to say, I would say there's not a specific, but we want to look at what you normally do and maybe take a chunk off that percentage at least at first, but then pushing things up gradually, looking at the physiologist here before I say.
Yeah, no, definitely. No, I agree with that, Rebecca. And it's modifying it. It's not just, again, you can't just sort of give one answer as to a specific heart rate percentage that you want to work to, because I think, if you're going through chemotherapy, as you said, Rebecca, then there's going to be times that you feel better than others, and certain days that you can push that intensity a bit more than other days. So, for example, if we're talking maybe the first week after chemo, that's probably when you're most likely to be most fatigued and suffering most with side effects. Well, that's probably a time that actually you're going to have to really curb the heart rates that you're working to and keep it pretty low to moderate in intensity. Whereas maybe that week leading up to the next chemotherapy dose, then that's the time that you can maybe get in some sort of higher intensity training if you're used to doing that. And I think that's the key. It's really what you're used to doing, and looking to just build up gradually, and not to overexert yourself and push yourself too much. And that's really not just looking at things as like a one-off session, but that overall volume as well. Maybe the week or that treatment cycle.
Yeah, I've got another question that is specifically for you from Josh. I've just seen on that, we can see that one, but I've got some thoughts on that. But they're specifically asking, Tom, for you on that, in terms of, can you work towards progression during your treatment? According to Josh, said he's doing the Rehab training specifically as well, so he's trained up in that. But is that something you can't do? It's a kind of rhetorical question. I might add into it. That's all right after.
Yeah, it's tough, Josh. I think it depends on the patient, and it really is individualized and depends on the patient. It may be possible to progress a little bit, but I think just bear in mind that people are, when they're going through treatment, then it's a lot for the body to handle. So yeah, I'm not saying, okay, we need to progress everyone going through treatment. It may be just more of a maintenance phase, and then you can gradually build people back to doing what they were doing, and build the fitness levels and progress everything again post-treatment is definitely a more sensible way to probably to approach it, and to try and maintain during treatment. Because if you think that with multiple rounds of chemo, then the side effects are potentially going to get worse, the fatigue is going to get worse, therefore the energy levels are worse, and everything becomes harder and harder to just maintain at that level. If you're trying to progress, then you're trying to progress whilst the body's also struggling more. So it's a huge jump to it becomes a bigger and bigger progression, is what I'm trying to sort of say. So yes, just to maintain in itself over that period should be seen as a success. Yeah. So
I think that's
does that sort of help, Josh, and summarize? I think if you can maintain what you're doing, then that should be a success, and look to maintain. Yes, you're probably going to have to reduce the intensity, and then just progress it as and when the patient can tolerate it again. But that is, again, it's individualized, so it's going to vary from patient to patient. Some people will get less side effects than others, and may be able to tolerate more, and may be able to progress.
Yeah, I suppose.
Yeah.
As well, what we do see, Tom, is people that will then, I know you've got some patients where we started from a pretty kind of low level, like okay for just general life, but we talked about like being more fit in terms of doing regular exercise, coming from a lower point in that, and actually just starting to do a regular program, which is something within what the body can adapt to, has actually probably been a fitness gain. I know I expect the prehab for cancer, I'm really excited to hear them actually, because that has been great in realizing that sometimes it's just important to get someone's fitness up before you even start a treatment, even if that means, a couple of weeks more before starting treatment. But I think for some people, that lower end of fitness, either because it wasn't there really before or because of being ill, that might be where we do see a bit of a gain, even if it's not gain on gain, at least it's kind of got there and then maintain.
Completely. So I think, Josh, going back to your question, you just got to pick and choose the times that you can progress. So you may be able to make some progression in that, say, last week leading up to chemotherapy, if the energy level is particularly good then and there's not really many side effects. And then just really, as Rebecca said, like getting a patient, referred to me often happens, post-diagnosis, but pre-treatment. So that could be before chemo, it could be before surgery. It's a great time to try and build the fitness levels up, to get people fit for surgery, to get people strong for surgery, to get the fitness levels up before chemo, because there's a chance, not more than a chance, like a strong likelihood that fitness levels, because the amount of activity that they can do during chemo is going to reduce, and the fitness level is going to reduce during treatment. So trying to get them up, as without pushing too far obviously, but trying to build up, because you're expecting a bit of a drop off during chemo, so get things as high as possible before makes sense. And as I said, sometimes that can lead to a better response post treatment as well. If we're thinking like surgery, then it can help to reduce side effects. I touched on the one earlier about sort of prostate cancer and someone having a prostate removed, is that we know that if we strengthen the pelvic floor before surgery, then that reduces the risk once the prostates have been removed of having incontinence and side effects like that post-treatment.
Yeah, it's really, there's a question that leads on from that, Tom, I think at the bottom, Astrid's question, that's really good about, can you exercise during, she's on ABVD treatment with Doxorubicin. I guess that's one where it kind of is exactly what you just said, which is like that, getting that balance. I suppose, Astrid, one thing I would say there is that we know that the treatment can be cardiotoxic. So we've got to be careful with the amount of stress that we're putting on the heart at that time. So like doing high intensity exercise at that time might be too much for the heart to adapt to both. So we're wanting to not stress it, not protect it. That doesn't mean you can't do any exercise, you do exercise around that. And I guess, like, I would say in that case, if someone that wants to run every day, it's like push for echo scans, make sure that you're going to get like the medical involvement. You can get cardio oncology to have a look at that. Exercise medicine can kind of make that much more prescriptive. This is the kind of question, I guess I could work on that with you, Tom. We design a program around that. How do we maintain it? We want to get you back to running, but actually for the heart, the longer term, the big thing is not to have heart damage or to limit that during your treatment. And that might mean doing a bit less in terms of intensity at that time. But then afterwards, we want to make sure, so like Tom said, you've got, your prehab, Astrid, sounds like it's been that regular running, and that's great because that has given you those health benefits. I think, as a runner, I know too, that when you have to have time off of it, it is, it's really hard, and it's obviously that feedback and obviously wanting to maintain it, for you to lose it. A lot of the benefits kind of have a long-term effect. You'll need to build back into them, but doing that slowly. If you need to then take a check-in from a heart medical side, then we're doing that, but then building and building on back, and that will get easier the further you get from that treatment. So I think the answer to that question might be, you need to be careful during the treatment. I think the other question that's not usually been asked is, how far can I go afterwards? And I think that's probably a further way in terms of what people want to do, strength or exercise, than we have traditionally said. And I think that's massively important, both for people long term, like you said, Tom, after prostate cancer, after breast cancer, there's a risk, after Doxorubicin treatment for younger people. I think that exercise will have a big role to play there. We've got some work on the research to do to know that, but I think monitoring it and building it, that's where you want to be looking to.
Yeah, great, Rebecca. Is there any others?
Have you answered most of them? I feel like otherwise we could be here all night and we don't want to take up everyone's time. Was there any others that you've like, or any kind of big topics that you wanted to cover quickly?
Okay, well, you'll have to tell me to start in a minute, because I'm just looking at one that said about COVID, chemo and COVID, which I might not be answering it right, Stephen, but tested positive for COVID, few symptoms and bloods came back normal. Did exercising work? Maybe. We know that like exercising can help the immune system. Great. We also know that anybody, cancer or no cancer, if someone gets COVID, please stop exercising. That's something else that I try and help people with, athletes getting back in. So yeah, I mean, some people may have a milder version. We don't know. We think generally cardiorespiratory fitness is good, but I think one thing for people is, if you do have COVID, coronavirus, do stop exercising during that time. Do get fully well. Do go back into exercise slowly is the bottom line on that. So a lot of people, will have been shielding, avoiding going out, and hopefully not have contracted COVID, and we've got vaccines coming along too. But I think that's one thing. We do think it helps the immune system, but we also know that we've got to respect that rest and recovery. If you do get ill, take a break, take a step back from where you were and restart slower. So.
Bro, I think we're going to have to stop it there, unless you've got any more quick ones that you wanted to answer, Tom. I know people are... I've copied them all, I think.
Yeah.
Perfect.
I can't see any more, Georgie, but if you've got any others that need answering.
I think I think you've covered a lot of big topics, and a lot of them were kind of specific. So I have written them all down, and we can kind of try and get back to everyone if we've missed a few. So hopefully I've written them all down. But yeah, thank you so much, Rebecca and Tom. That was, I think on behalf of everyone, we're getting some thumbs up and some happy faces. So I think clearly, like, knowing nothing about any of this, I can tell that everyone obviously has loads of questions, and I think we're going to have to ask for a follow-up on this at some point, because there's still so much obviously to cover. So if you guys are willing, we're getting some thumbs up on that. So brilliant. Thank you so much for taking time to listen. I've started to put some links already in an email, and we'll definitely send that around. So hopefully that will help point people in the right direction. So another huge thanks, Tom and Rebecca. Really, really appreciate it. And thank you everyone for taking the time to listen.
Thanks for having us, Georgie, and thanks everyone for listening. Thank you so much for your time.
Awesome.
Thanks, Georgie, and thanks everyone. Hope that helped.